Armando Hasuringan, Biology and Medicine videos. Please make sure to subscribe, join the forum and group for the latest videos. Please visit Facebook, Armando Hasuringan. So cancer. Cancer is where you have uncontrolled proliferation of cells that arise from virtually any type of cell in the body. So basically you can have bone cells, skin cells, gut cells, and they can all develop and become cancer cells. The word cancer itself comes from the Greek word carcinoma, which means crab. Hence the horoscope stuff. The people who are born in Cancer also has a crab symbol. Let us look at an example of cancer that may occur in the colon or in the large intestines. So here I am drawing the large intestines, also referred to as the colon. These red mushy looking things represent a tumor. Tumor refers to some form of new growth. But when dealing with cancer like tumors, it is better to refer to tumors as neoplasia, which means new growth. But either way, tumor and neoplasia mean the same thing, which means new growth. But in this video, I will use the word tumors more rather than neoplasia. Now, cancer is a type of tumor that usually grows rapidly, but not always. Some tumors are slow growing, such as the ones that occur in the lungs. Another fundamental thing to take in is that the term cancer refers to a malignant tumor and not a benign tumor. But what is the difference between a malignant tumor and a benign one? Well, let's have a closer look at the colon tumors here and see if we can differentiate it. So here we have a section of the colon. This tumor here, let's just say, will represent a benign tumor. Now, a benign tumor is slow growing. It is relatively localized and has a well-defined capsule, so it doesn't really break off. It's there. It also, the colon naturally has a blood supply and nerve innervation, here shown here. Of course, a benign tumor is not very dangerous, but as it grows, it can increase in severity because it can start pressing against nerve fibers, for example, and can produce pain. But other than that, benign tumors are not cancerous. Now let's look at a malignant tumor, which can start off fairly small, but as it grows, the severity increases drastically. This malignant tumor is not contained and can start digging underneath the layers of tissues like so. And during this time, the tumor will produce chemicals that will cause surrounding blood vessels to grow. And so big tumors often have massive blood supply to feed the growing need. So the malignant tumor is characterized by, first of all, it's cancerous, it grows rapidly, it's uncapsulated, and it consists of different types of cells because of various mutations that occur. And of course, when I mean a malignant tumor, I mean malignant tumors can also break off and travel to other areas or other organs in the body and cause tumors there. So it's very dangerous. So benign, not so dangerous. Malignant, very dangerous. So off to a different topic. Let's look at some commonly diagnosed cancers. So here I am drawing a lung because the lung cancers are the second or third most common diagnosed cancers in male and females. And this is because, one, there are many smokers in the world, and two, when cancer spreads from somewhere, from one area in the body, it usually spreads to the lungs first. So for females, the most commonly diagnosed cancers are breast, lung, and colorectal. Colorectal means anywhere in the colon or rectal area. For men, the most commonly diagnosed cancers are prostate, lung, and colorectal. Now, the current 5-year survival rate of 60% after cancer diagnosis means that people are living. And this is great, Hopefully in the near future, there will be improved treatment and interventions that will help people with cancer to survive longer and in comfort. Now let's learn a bit more about the pathophysiology and progression of cancer. So we're looking at a malignant tumor. Now let's learn a bit more about the pathophysiology and progression of cancer. So we're looking at a malignant tumor. So here we have a layer of cells in a particular tissue. It can be from the prostate, the breast, for example. And this is normal. These are healthy cells. And let's look at it from a different view, from a bird's eye view. So here we have the cells, and they are dividing in a controlled manner. And of course, the cells have a blood supply. However, one of these cells here, normal cells, can become cancerous. When a healthy cell turns into a cancerous cell, the process is known as transformation. And this can be caused by genetic changes where you can have alterations in the genes. It can be caused by an infection, or it can be caused by an environmental factor, such as carcinogens. And recently it has been said that air pollution is one of the main causes of cancer. So this is the main environmental factor. So these genetic mutations, infections, and environmental factors are basically the causes of cancer. Once a cell becomes cancerous, it will cause abnormal changes to occur in the tissue. This is referred now to as dysplasia. So dysplasia is abnormal development or changes in the tissue. So here I'm representing the layer of the cell turning red as abnormal. Before continuing on, we should know a little bit more about the cancer cells. Just to summarize, cancer cells basically do their own things. So cancer cells are characterized by anaplasia. Anaplasia means loss of differentiation and organization. So first of all, if a normal cell becomes a cancer cell through mutation changes, the cancer cell itself can have further mutations, causing it to be different than the previous one. And so you have a variety of cancer cells. They're never the same. Now, loss of organization means that these cancer cells, they don't have to stay in one layer. They could just stack on top of each other, even though they're not meant to. Finally, cancer cells are characterized by autonomy. Autonomy means independence from normal cellular control. So normally cells will divide in a controlled manner. So it can divide slowly, for example. However, in the cancer cells case, the cancer cells divide very rapidly. They proliferate heaps. They are not under control. So essentially, after dysplasia, as the cancer cells multiply and proliferate very rapidly due to the characteristics of autonomy and anaplasia, the tissues can develop and become a neoplasia, a tumor. Because remember, neoplasia and tumor means new growth. So these red things now are all cancer cells, and they're stacking on top of each other. So looking at it from a layer point of view, these red cancer cells are stacking on top of each other, creating a tumor, a neoplasia. Further, you can see that there's a variety of colors, meaning that a different variety of cancer cells due to continuous mutation. Further, new blood vessels will also begin to form to supply nutrients and energy for these cancer cells. Then, after a while, the cancer cells will divide even more and can become an invasive neoplasia, where the new blood vessels are formed all around the tissue. And the cancer cells can essentially move into the blood vessels and invade other organs and tissues. So looking at it from a different view, you can see how these cancer cells are multiplying and creating a tumor, a neoplasia, and at the same time the bottom layer is penetrating through the tissue into the blood vessel. And so when it goes into the blood vessel, it can invade other organs and other tissues. So I hope you understood those processes. So from dysplasia, it can become a tumor, and then it can become an invasive tumor. Let's learn a bit more about the formation of these new blood vessels and why is it important for cancer cells. The process of new blood cell formation is termed angiogenesis. So angiogenesis is new vessel formation and maturation. So here we have the blood vessels with its epithelial cells. The blood vessels have to supply the cancer cell, the tumor, because the tumor needs nutrients to grow, to keep growing. So here we have the cancer cells, and they're multiplying very rapidly, these tumors. And as you can see, there are different colors here, which implies different variants of the cancer cells. Within the blood vessels, you find red blood cells and other things. Now, these cancer cells, this tumor, this neoplasia, they secrete what's called angiogenic factors. On the epithelial cells of the blood vessels, you have these receptors for these angiogenic factors. So these angiogenic factors that are secreted include VEGF, PDGF, and BFGF. And they bind onto these receptors. So they bind onto these receptors, and they will essentially cause new blood vessels to be formed. And so this will allow the cancer cells within the tumor to enter the bloodstream more easily through pressure or through other means, such as secreting some form of chemicals. So when these cancer cells enter the bloodstream, they will encounter the immune system there. And the immune system will obviously try to destroy and stop these abnormal cancer cells. However, with so many cancer cells, and maybe with a deficient immune system, the immune system obviously cannot keep this at bay, and so the cancer cells can successfully enter the bloodstream and travel to other organs and other tissues, causing further problems. And please, what we saw then was a malignant tumor, not a benign tumor. And that concludes the video on Introduction to Cancer. I hope you enjoyed it. Thank you. So here is a breast, and as we know, cancers are commonly diagnosed in breasts for females. Here we have a healthy breast. Taking a section of this normal healthy breast, we can find endothelial cells here, as well as blood supplying it. We can also find lymph vessels here. Now let us learn about the pathophysiology and progression of cancer and how it can spread. These epithelial cells, they can turn into cancer cells through environmental factors, genetic mutations, or even an infection. When a healthy epithelial cells become a cancerous cell, it causes the tissue to become abnormal. This is referred to as dysplasia, where we have abnormal tissue development, essentially. The cancer cell, where it begins, is known as the primary site. And so if a cancer cell were to move or spread, the second area would be referred to as the secondary site. So for now, seeing that this cancer cell arose in the breast, the breast is the primary site of this cancer cell. This cancer cell, because it is not under normal control, not under normal body control, it will begin to proliferate and differentiate. And it will just keep dividing and dividing, forming a neoplasia, forming a tumor. So here, this red bulge, we have all these cancer cells forming growth, forming a tumor, neoplasia. We can also see changes in blood vessel. Through angiogenesis, the new blood vessels are formed due to the secretion of chemicals by the cancer cells. As we know, this lump of cancer cells is known now as a tumor, neoplasia, but we can also refer it to as a carcinoma. Why is this? Let's learn a bit more. Let's learn a bit more about the terminology of cancer. Words ending in oma means growth. So, for example, melanoma means growth or tumor of melanocytes. Growth, new growth of melanocytes. Lymphoma means tumor of the lymph node. Carcinoma means tumor of epithelial cells. And adenocarcinoma, for example, is tumor of glandular epithelial. And so seeing that the cells we just looked at are epithelial cells, we can refer to as carcinoma, so breast carcinoma. Now, the cancerous cells in the breast can still proliferate and differentiate and become more aggressive. And as it does this, it will also begin getting more blood supply to feed it, to provide nutrients to it. And so when this occurs, this neoplasia is referred to as invasive because this neoplasia can now, the cells can break off and essentially enter the bloodstream and invade other tissues and other organs. Hence the name invasive neoplasia. So here I'm just drawing the blood supply in blue because it's a vein. It's just going to return to the heart. These cancer cells here will enter the blood supply and move towards the heart. So the embolization and detachment of cancer cells occurs. These cancer cells will essentially enter the circulation. Often, or most cases, they're often destroyed by the immune cells because the immune cells realize that this is not normal. However, if it keeps continuing and the cancer cell survives, it will be transported. It will go into the heart via the vena cava and essentially be pumped somewhere. So this cancer cell is entering the heart and it will be pumped out. So the heart is for transportation. It's for transportation of cancer cells. Now, the site where the cancer cells are usually transported to first are the lungs, because as you know, the pulmonary arteries leaving the heart will enter the lungs, like so. And so the lungs are often the second site of infection, the secondary site. So these cancer cells will adhere to the endothelial walls, vessel walls of the lungs, and essentially invade the lungs. So here we're looking at the normal lungs first. We have the endothelial cells of the alveoli as well as the blood vessel. The cancer cells here will adhere to the vessel wall and essentially invade the lung. So recapping, the cancer cells will adhere to vessel wall and through extravasation will essentially colonize the lungs. From here, the cancer cells will proliferate and also cause angiogenesis. And through this, it will form a tumor. It will form a neoplasia. So now, this is referred to as a cancerous lung. So what happened is that the invasive neoplasia established in the new environment, and this new environment is the secondary site. Remember, the primary site was the breast, and because the cancer has spread to the lungs is known as a secondary site. So looking at it from an external view, the lung here will develop tumors in the lungs, and this is what it would look like if we zoomed in. And this is caused by the proliferation of the cells as well as angiogenesis. When the cancer has spread from the breast to the lungs, this process is known as metastasis. And so because the cancer has spread to the lungs, we call this lung metastasis. And so we can say that the cancer cells have metastasized, have spread. Metastasis marks tumor as malignant because benign tumors, remember, are not metastatic. They do not spread. They are not invasive. Further, these invasive neoplasia, these invasive tumor cells, cancer cells, can also travel through the lymph vessel. And as the same thing, it can spread to other tissues and organs. For example, when it enters the lymph vessel, the lymph vessel can travel to the heart, and then the cancer cells can then be pumped from the heart again to other tissues. The cancer cells, for example, if it metastasizes again from the lungs, it can be transported to other areas in the body. So the cancer cell can re-enter the heart here, and then it can be pumped out through the aorta. It can travel through the ascending or descending aorta. The cancer cell can invade the brain, causing serious consequences, essentially death, or it can infiltrate the bone, causing complications such as anemia and basically clotting the blood flow. That was just an overview and a summary of how cancer spreads and essentially the pathophysiology of cancer. I hope you enjoyed it. Thank you.